Good afternoon. I'm Dr. Bill Wyatt, and I'm a general dentist, and I work with the American Orthodontic Society. I'm board certified in that, and have been doing nothing but orthodontics for the last 42 years, and I did a lot of orthodontics prior to that, but I had my practice exclusively in orthodontics and some temporomandibular joint work for about 42 years. So anyway, I want to discuss a very unusual case here this afternoon. This lady was referred to me. She had this work done in Arizona somewhere, but I had a patient that was a dentist in Oklahoma that I had treated her teeth, and this young lady moved to Oklahoma and was her patient, and so she referred her to my office to do this, and so it was a quite unusual case. So we'll get right into it. Now, she had had some orthodontics done, and it was really botched, and they had taken out some teeth up above, and I have yet to figure out what on earth they were doing with that. I'm not sure she was thinking about any type of surgical procedure or not, but her teeth were pretty bad. No teeth extracted on the bottom arch, and her face was pretty flat. So we have three things that I wanted to bring out, and one of them is the reverse headgear and an upper lip bumper, which was made strictly out of one strand of 040 stainless steel round wire. And you'd think it'd be terribly uncomfortable, but they're very comfortable, and you can adapt them to any angle of the lips or the gums that you want to, and they work marvelously well. And we opened, her teeth had been removed and the space was closed up. The bottom teeth were real crowded up, and her face was fairly flat. So we wanted to go in and open this gap up, bring it back to a normal profile, and then she could get implants or bridges or whatever she wanted. I didn't do any of that, and I don't show that done, but we put this reverse headgear on her. And let me get down and show you the young lady. She had a very straight facial profile. She's about 30 something years old, and came back from Arizona. She moved to Dallas to go to mortuary school, and here's the profile. The facial height's good, no problem. There's a little bit of excess, no big deal though, and everything looks pretty good until you open her mouth. And she's got a good smile line and all that, so we can go in there and do this. But when you look at her teeth, I mean, she's in a cross bite here, and these teeth are extremely crowded, and the bite's too deep right in here, and it's just hanging on the edge over on the other side. And when you look at, both arches are too small really, and you look here, you can see this crossbite in here. This enamel on this tooth is kind of flaked off some way or another, and there's only one bicuspid here on this side. That's a 6-year molar and 12-year molar, and cuspid, of course, it's a first bicuspid, I think, maybe a second bicuspid. All right, the same thing over on the other side, yet all the bicuspids and everything are in down on the bottom arch. So it'd have to be extremely crowded. It's even though it's really a class 2 situation, the upper arches further out of these molars are out. The lower molar ought to be out here somewhere, and it's back behind the upper molar, so you got that problem. So we want to correct that in our correction, and I decided it would be better if we opened the space back between the molar and the bicuspid to put the implant or bridge or whatever she chose to put in there later on. So that's where we opened the space, and this was 1987, and we got a very similar situation on both sides of the mouth, not as bad on one side as the other. Now the midline, strange it is on pretty good. I mean, well, that's really good. But then the teeth are crowded, and that makes a whale of a lot of difference in where the midline just happened to end up in that spot right there. So we're going to open this bite too, and then we'll push these upper teeth forward and put some torque on them in this direction, see, and open a space between the bicuspid and the molar. I think is where we open it. We'll see that in just a minute. Okay, coming on the other side, a very similar thing. Got some space up there, no big deal, but it was an most interesting case. So we start out, excuse me, added some spring between the bicuspid and the molar, and you probably have to put some tip in this, something like that, to make this root go out, and put a little tip in this to keep this root back, so that if they do an implant, you'll be able to get the implant in between the roots there. So we start that. This is a little wildcat wire that we used back then, and you could use 1/6 9-tie if you wanted to, or any very flexible wire. And then this is our intruding wire, and we were using that back in those days also. And that's where remember that little loop comes around, then you bring this around to the other side, and then you build one of those same loops that you put in here, and this wire would be going way down here. You bring it up and hook it to these anterior teeth. See, it's tied there and here, and it'll bring this down and put force on these teeth to push them up. Now this occlusion will bite on this and keep this molar from rearing up very much. You'll have to try that to see it. The force to lower these teeth is coming from this molar, which is being pushed up, but the occlusion is biting the molar down, and it'll stay pretty much there. And so it is something you need to know about. Now we're gradually opening this gap, and we left a little wire in here. You see how we turn this down at the end, so it's bringing the teeth on out there. I've got a kind of a stopped up throat today, so I'll be cleared my throat quite a bit. Okay, on the anterior part of the mouth, we're opening this gap here so we can straighten these teeth out. Now as we raise this up, we go down with this, we've also got this wire would be up like this and bring it down, so it's picking these up a little bit, but not near as efficient as this intruding wire back here at the back. So we go here we come along, and as this pushes these teeth down, this tooth kind of rears up, and you'll have a little space open in this gap right here, and you can bring these teeth back into that and give you some more room up here in the anterior part. I'm just going over some of the mechanics that you'll run into in something like this. And here, looking at it from the top, we're going to shove this tooth up here, and then they're planning to crown it. So I never did line it up. Ideal, if they were going to use an implant, you'd want to get it lined up a little better, and you'll watch how we enlarge the arch like that. Now on the bottom, as we're correcting a class 2 problem too, see, so we're having to bring this out in addition. So now we'll open this and we'll rotate this tooth here, rotate this, and all the teeth are in here, and we're going to line them all up and keep them all in place and just restore her mouth kind of back like it originally was. That's what she wanted. Now, I don't think I've shown this upper lip bumper like you see here. Now this looks horrible, and it looks like it'd be very uncomfortable, but it is quite a comfortable lip bumper. In fact, people really like them, and they don't take these out very much. You know, they can clean around them and everything. And what you do, I'll just clear this sheet and draw one of them for you. We make these, I just make them myself. You can sit there and make one in just a few minutes, you know. Let me go back. Okay, we take an 040 round stainless steel wire, and the stick of it is about 14 inches long, and usually we just use the whole darn wire. You see, and you start at the center and put your young plier. It's got a big, not that big, it's a loop on the thing about like that, and you put it in the center, and then just got it sitting in here, and then you bend this back both ways like that. This is not going to be made real pretty. Now you take it up and put your plier here, and you bend this leg up, so now you're going to come down and you'll have a loop going up like this, and then you catch it and bend it down like that and up like this, and then back down, and then come straight off of the top of this, and now you make your dog leg or whatever you're going to put into the headgear tube. And as you end up, you've got the headgear tube here with a kind of an out bend right there, and you come over here and you go down with it kind of like such. Now you can bend this thing and shape it just like you want. See, if the teeth were sitting at this angle in the teeth, you can mold this thing right there. Just mold it to where it's sitting right here, see? And it doesn't touch the tissue. You'll have to practice that a little bit, but this is a real efficient way to move teeth forward. And I wanted to cover that, and I don't think any of our videos have really done an adequate job of covering that. Let me erase this part right here. Now I can bend this thing in or out and have it stay away from the tissue in the front. Now what we want to do is move this whole segment of teeth out. We want to come forward at least about a quarter of an inch, really more than that, because we're going to have to make plenty of room for these teeth down on the bottom. Now, so you have to keep this away from the tissue in here. I don't know how many of you have used reverse headgears and stuff like that and brought these upper teeth out. I never know who in the heck I'm talking to. You may have had a ton of experience and you may be completely new at this. And if you just go back and forth, you can learn how to do this over these videos. They're neat. Now, if I want to expand it, all I have to do is just open these loops, and I can put a expansion loop back at the back if I want to. Or you just expand the thing, and then you kind of angle it over this way or that way, and the teeth will be angled, say something like this in the bone, and you just have this thing going right in like that, you see. And it's comfortable, and they wear it virtually all the time. Now, what I wanted to get across to you, though, is that if you're moving all these teeth forward, that goes from the bicuspid, cuspid, lateral, centrals, everything's coming forward. Now, it's best to have a kind of a vascular bed go out in front of the teeth rather than shoving the teeth into some tight lip structure up here. You let this thing right here push the lip out of the way and get all the pressure off of these teeth. And then your other pressure on your reverse headgear will be able to pull this whole front of the mouth out much, much better. Now, I didn't go through orthodontic school, but I've taught with several, the head of the school at Emory. He and I taught together for a while, and Dr. Larry Wyatt has established a school down in San Antonio. He and I taught together for a long time. And I don't know what you learn in orthodontic school or whether you would ever tackle a case like this in the orthodontic school. Now, this case was unusual in that I was seeing her over in the little town of Hearst, and it's about 25 miles from Dallas, and she drove out to the office and then went back to Dallas, and she was working in a mortuary there in Dallas. Well, some body in the orthodontic department or something had passed away, and lo and behold, she was the one working on the deceased person. And I don't say this to criticize them in any way, but she was a real fan of mine, and they came in, and she said they followed me around wanting to look at my teeth all the time, wanting to see what was being done. And they said, well, why didn't you just come over to the school? Said, we would have done the same thing to you. But somebody in Arizona had really messed the case up. I didn't never know who it was and didn't want to know, really. But anyway, we're going to try to restore it back to the way we think it was anyway. And so this is an important part of orthodontics, and you need to learn how to do them. Now people go out and buy these darn lip bumpers. I can make them off of a piece of heavy arch wire and just put an acrylic deal on the front by putting acrylic onto Scotch tape on there and angling it like I want it. But this one is adjustable. You can angle it any way you want to at any time you want to, and you can expand it going out this way. You just stretch these things out, it is a neat way to do a lip bumper. And this takes this lip pressure, pushes it back on the molars back here, see? And that helps you open this gap in here and takes all the pressure off of this tissue and everything, which helps it. So this is a neat trick to learn in orthodontics. And if you haven't done that or were taught this in orthodontic school, you come over to the AOS, and we've got some sharp instructors there, and we'll teach it to you. So if you can't learn it off of this thing, but we're open, you can join the American Orthodontic Society, and if you take so many hours and you stay in there so long and you learn this stuff and you can pass the boards on the American Orthodontic Society, I'll tell you, you can do orthodontics, and that's a fact. So if you don't know this, how to do it, and I don't have a foggy idea where you are. I looked at them astonished. These videos are going all over the world, and I've never had an audience like that. So I hope this will ring a bell to you, and you can learn how to do that. It's really not very difficult. So now we'll go ahead here. I think I've got some problem coming up here with my telephone, and I'm going to have to pause. Okay, back in business again. You can't hardly do these videos without some interference. Now, here is the reverse headgear. It's a kind of a chin cup deal. Fits down here and has a couple of legs coming up. And one of the secrets of this is have these elastics going right where the lips meet together, right in here, the lower lip and upper lip. If you got this, you have to have your upper lip up here. It won't go too good, but you want your lips to part right at this place here. And here's a kind of a hook we bent in that. Goes down. This is on the chin cup. It has a deal going around and either go over the back of the head, you put across the top of the head, and you can they move their hair forward, and it works like that. But it puts a lot of pressure on the lower jaw to pull this out, and that's why this lip bumper, it takes the pressure off of these teeth. You don't have any lip pressure coming in like that on this type of deal now. So here it is from a different angle, and you're constantly pulling this. Now this young lady wore this thing while she was working, and she didn't, of course she was back there by herself most of the time, but when the people in the department, orthodontic department there, came in and were following her around wanting to see what she was doing and see what this thing was. She was really curious. It kind of fascinated her, and so she was telling me all about it when she came back for the next appointment. Now, we pull this up, and if I had really wanted to, I could have, you can take that elastic, attach it here and run it around, grab it on the bracket, and it'll spin that tooth in that direction. But she was going to have a bridge put in, and they would prepare this for a crown, and I wouldn't have to be worried about the roots and the implant or anything. So she did get it bridge in there, but I never did get to see it, so I don't have any pictures of it to show you. But we brought these teeth from here about 1/4 of an inch, whatever the width of a bicuspid, out and put them over the lower anterior. And we'll show you that in a minute. Now the lower, we just rounded this all out and lined it all up and just put it in a class 1 relation and just restored her mouth now. And there's a lot of little bends in here. Now, see, your lateral is a certain thickness and a cuspid is much thicker. And the straight wire appliance, they just make a bracket a certain thickness, and you make the difference, you see. So when I was bending this rectangular wire, when I got right here, I made a little out bend to compensate for the thickness of this. Now, a lot of times the thickness here and here, so we'll have a molar offset and a cuspid eminence right here, and both of them out a little bit. And friend, let me tell you, you can talk all about buying these arch wires and sticking them in and you don't have to do any work and all this kind of bull. That is a bunch of bull. I'm not kidding you. You need to learn how to make some bends in the cotton picking wire if you want to do a beautiful case. See, you've got to learn to bend the wire some. So whatever people tell you when they're selling this stuff, don't believe them. Excuse me. You have to know a little bit, and you want to keep this edge just nice and straight. This isn't perfect. And go right in here, and these cuffs go right inside the upper bicuspid will come down like this, you see, coming over here. And that's the way they work, and so we gotta do them that way. All right, here we are. Some reason or another we got a midline off, but you know, we could have two sides discrepancy or something in here that made this, and of course she's not brushing or getting that clean good enough for me. And this has the gaps in here. Now we just filled in that with our retainer, and they wear this retainer virtually all the time. And let me see if I can, okay. Now when they close their lips together, you can see that much of the front teeth. My wife was asking me just today, we were talking about, seemed like more ladies have a high lip line in here and you see more gum than you do on men. Now, men after they're older, your lips are dropped down and you can hardly see your upper teeth. You can talk, a lot of men show their lower teeth when they talk, but when they smile big, well, you'll see about that much of the teeth. But if you're somebody that breathes through your mouth a lot, your little lip will be short up here because you don't keep it pulled down. Your lip stretches as you grow. These African lip and people in New Guinea and places, they make their lips go like this, you know, and they can make them like a duck's bill almost. So your lip can be stretched. And when I was a little boy, I had a mouth breathing, and I still have a mouth breathing problem, but I don't have the lip problem. My lip was high, and I remember my mother worked for this orthodontist in San Angelo, Texas, and he was a labiolingual guy, and he had me stretching my lips over my teeth. Just pull it down like that and hold it and pull on it a lot, and it will make your lip grow longer. So if you have a high lip line and want to lower it down, you might try that little trick every once in a while, or do it a lot if you really want it to grow much. Now here is the gap that we've got in here, and they'll come in, they're going to crown both of these teeth and fix that up and fill her face out. And she's got a pretty nice set of teeth in. So this is a rare thing that you're going in on somebody that kind of screwed up the case. I don't know how, but they took out teeth up above. I have no idea what they were thinking about when they did this case. But anyway, that's what we ended up with. So we put the acrylic in here, you see, and you occlude the lower teeth against this, and she can wear this. If you want to run a little piece of kind of wire through there and hold that to strengthen it, you can do that. Now this retainer has a wire coming up in here. It's an 036 wire, this one down here, and you can run a piece of, say, 030 or something like that in here and come out, and then put this acrylic in with it, put it in there, and you put it where it'll go in there, and then you come in and put the retainer in after they've worn it a while and fit this in the mouth and put this and let them bite on it so that the bicuspid below it will have something to hit. The cusp of the bicuspid down on the bottom will come up and touch that, and that'll keep it in the right deal so that when they make a bridge across here, it'll work for that. Now I'm talking, I know people that are experienced in doing orthodontics. I can bore you to death, but there are a lot of people who don't know exactly how to do. So I'll try to answer all these. I don't get your questions here, but I try to think of what you might want to know, and I try to answer those as we do this. So here we go. This is 1991 now, after and that's 91. That's the upper arch. We must have straightened these teeth around a little bit. They look pretty well lined up right now. And here it is. This is that 2003 or 9? No, that's 92. That's 1992, and we're got the upper one in with a retainer, and we're just finishing the bottom part down here. Let's see. Let me go back there. I left some of this coloring up there. All right. This is 87. Okay, this is the way that arch looked in 1987. I think it's about time we started this work. And we're going to open the gap right here and right here. And just watch. Now I think we just jumped to the upper arch. Yeah. All right, you see how much difference there is in these arches now. It's kind of, I don't have it measured out for you, but I'll go back. Let me see. No, go this way. And you see how this is more of an arrow kind of pointed thing here. And then there it is. And this is much prettier. When you smile, you still see teeth back on the side over here, and we're ready for them to put a bridge in, or put bridges in. Now, if somebody had left their wisdom teeth back there, I could have pulled them up and closed this whole space up with the teeth from behind. You know, we could have closed that whole thing up for that, and we shown you how to do that. And I hope that rings home. Now here, see how crowded this bottom arch is right here, and it's also kind of a pointed thing. Now I think this will take us across there, and you see the bottom arch. Let me just kind of rock that back and forth, and you can kind of see it. Now, that's what you want to do. This tongue will adapt to that, and if you want to come in and put a 3 to 3 or a 4 to 4, sometimes we put them right in here and go all the way across there if we're concerned with how they're going to fit together and everything, or if it'll stay with it. Now, we put them in retainers, and I haven't watched retainers. We watch them the first year for nothing. They just come in and we'll watch them, take care of them. I won't say lose them, they have to buy a new one, but we watch them for no cost at all. So we've gotten this down to a class 1 relation now. Now this is the x-rays as we went along. This is 1987 right here, and this is 1990. She's 37 years old now, so she knows spring chicken when we get in here working on this. And the teeth that we pulled on a lot, you'll notice the periodontal membrane, she may have lost a little root structure here. We'd have to look at that from some different angles, but I've been straightening teeth now for about since 1956, and that's a long time, and I've never lost a tooth from root resorption, regardless of you have a lot of root resorption, but don't be afraid, because I've gone through a lot of tough cases, and after we get home with it, this is the root we've got. This is 1992, see, and the roots, I don't think they grew back out there, but they darn sure look different. Let me go back and look at some of those others. Now, it may have been that the angle that the tooth was laying made the root look shorter in here, but that darn sure looks shorter. Maybe this part may be filled in. I don't know what it is. I didn't doctor it up at all, but as I finished up with it, that's the last, I think that's the last Panrex I have on her. Now this molar here includes for here, and this will straighten out some extent. Now we did some transcranial x-rays to see, because we were pushing back on the mandible, you see, and I didn't want to crowd this retrodiscal area. And this is the right side of the mouth, and this is closed with pressure, and that's relaxed, and here the condyle is out, and when she opens her mouth, you follow the condyle, see, and you can see what is the condyle. Now here it is starting, out here's biting and relaxed, and then the condyle is out here now somewhere, and that's the eminence, and this is the ear. Okay, but she had no TMJ problem, and we took her through this and got her in a good class 1 relation. And this is herself in 1992, and here it was in 87, and it looked okay, except these teeth were real crowded in here, and these are straighter up and down than we wanted. So it looked like something had been done. I don't think her jaw had been she may have had some surgery done. I can't tell. There's something going on there. But here she is when they finished. And there's her smile. And there's her teeth. So Anyway, hope you get something out of this. I know we took longer than I really wanted to, but there were several points I wanted to cover. And when you are trying to learn something, you don't mind spending a little time. Now, if you're just thumbing through the catalog, well, I'm not too worried about you. But it's the people that want to learn how to do this that I'm concerned about. And I want people to know how to do it right and not a bunch of junk. I'll tell you, that's what it is. If you are a real serious student, then I'm all for you. Now, I am for people, just individuals on the street, going in there. If you have this problem and you want to do it, you can look in here and see how it's done. Now, I think it's done right. I would do it the same way now that I did a few years ago. And I may have some people that think they can do it better now, and if they can't, hallelujah. If I knew a better way to do it, I would darn sure do it and teach it to you. So anyway, I'll hush up and we'll close this out, and I hope to goodness some of you get to use this. And you may be in Timbuktu. I don't know where you are, so we get people from all over the world. So I'll hush and hope you get to use it. Thank you for listening. Bye-bye.